recording. All right. All right, we are live. We are live. Hello, everybody out there in social media land. Welcome to another episode of A Youth Perspective. I am Dr. Kent Key. We are the Flint Public Health Youth Academy. We have our youth interns in, and when we say youth and we mean young adults. We mean high school, college. We're talking about some professionals in their own right who went to APHA in November and showed all those PhDs and MPHs that they have just as much knowledge and understanding about public health and public health science as they do. So we are so excited that this talent came and is birthed from the Flint area. And this is one of the things that we really want to show the world, that our youth were not damaged because of the Flint water crisis. If anything, it gave us a greater hunger to want to know more about public health, to want to know more about health and medicine in general, and about research. And so our hope is that the city of Flint and this area will be the epicenter for launching and creating a workforce that's diverse and that's dedicated to eliminating racial and ethnic disparities and inequities in healthcare and in social justice. So we're excited about another opportunity. Today is going to be a real easy breezy type of fun video, but it's not fun when we think about the topic. We're going to do a reaction video, and we're still talking about COVID. Yes, COVID is not over. It's not in the headlines and on the paper all day because we don't have thousands of people overrunning hospitals like we used to. Part of that is through effective messaging. Part of that is through a nice percentage of the population getting vaccinated. Part of that is a nice percentage of people wearing their mask and social distancing. But we want everyone to know COVID is not over. There are still people in the hospitals. There are people still dying due to complications of COVID. There are people still on respiratory machines in hospitals across the nation. And so we want to make sure that we keep this in the forefront, kind of like the Flint water crisis. It ain't over. People just not talking about it no more. So we're excited. So we're going to give way for our interns to greet the people and just say, hey, how you doing? If there's something you want to share with the audience, you have time to do that, and then we'll get right into our reaction video. So I'll start with Everett. Go ahead and greet the people and tell everyone, how are you?
Hey, everybody. My name is Everett Graham. Like he said, I'm doing pretty good today. It's good to be here. Haven't been here for a while, so it's good to be here with everybody, and I'm glad to have this conversation.
Great. We'll bounce it over to Cruz.
Hey, it's Cruz Duhart. I'm feeling all right. I'm really enlightened and empowered that we're discussing some of these things that go unnoticed and don't get talked about, especially because we all feel kind of anxious about these type of things. So at least as youth, we get to discuss them in a forum like this. Hope everybody else is doing well.
Thank you, Cruz. Now we'll go to Amir.
Hi, hello everyone. I'm doing good. It's cold, but other than that, I'm doing solid. I'm excited to talk about this topic, and hopefully, it'll be set in our minds about long-term COVID. And yes, have a good show.
All right, and who came on after Amir? I think it was Briante.
Good evening, everyone. Looking forward to learning more from everyone else, hearing everyone else's reactions, and talking about a topic that hits close to home to some of us. So let's get into it.
All right, then we have the world-renowned TV host, Kaylin Shannon. She's coming after you, Oprah. Go ahead, Kaylin.
Look, Oprah, we can be in this together, really. Hello, everyone. My name is Kayla Shannon. I am a junior at the illustrious Spelman College in Atlanta, Georgia. So excited to be here with y'all tonight. I'm excited to continue to bring attention to an issue that is impacting lives throughout the nation.
All right, bounce it over to Cole Mays. What's up, Cole?
Hey, what's up, Dr. Key? My name is Cole Mays, and I'm a forever Flint resident, as well as I've been here for 2 years. I'm excited to see what type of videos we're going to see, as well as I'm always encouraged to see you guys' reactions because you guys are great.
All right, tag team on over to Tomas.
Hey, good afternoon, good evening, everybody. My name is Tomas Steele, and I'm excited to be here with you all today, serving up some great knowledge for you all in social media land. And yes, we might be discussing long COVID, but we're here to come up with long solutions, long positivity, and long love for all of you all out there. So I'm gonna let Dr. Key pass the mic on to somebody, but I'm happy to be.
Saving the best for last, the Dr. Monisha Summers. Go ahead and greet the people.
Hi, everybody. How are you doing today? I'm Monisha Summers. I work at Michigan State University, and I'm just happy to be here and hear about and listen to the discussion and participate if possible. I have my son, so it may be a little bit impossible, but
it's okay. We're raising up the next generation of healthcare professionals, so you got to start them young. All right, so we're excited to have this conversation. We're excited about the opportunity to have dialogue and to share information. Hey, Mason. And so what we want to do is first have everybody stop, pause, go to your Facebook and share this live. Those of you out in radio, not radio land, that's my radio show, that's tomorrow. Those of you who are out in social media land, stop and share the live. Let your friends and family and your followers know that the Flint Public Health Youth Academy is live right now. We're active right now, and we would love to have their engagement, their comments, and their interactions. So we're pretty excited about it. On last week, first of all, we want to pause just in respect to, we are starting to see mass shootings every day. And to the point to where the Flint Public Health Youth Academy in November of 22, right before we went to APHA, the interns decide what our focus will be for the upcoming year. And the fire interns decided then that gun violence would be the focus, not knowing that just last week, a week and a half ago, that we had another mass shooting so close to home on our Lansing campus at MSU. And so this is something that is surreal. It is something that is happening every day. Young people, when I say young people, I mean elementary kids, are no longer just having to do tornado and fire drills. They're having to do active shooter drills in pre-K and kindergarten and first grade. That is almost mind-blowing. And we're having to do drills in the places where we work now, because this is becoming normalized. This is not what we want to normalize. And so we will have an entire campaign this year focused on gun violence and gun violence prevention. And then we also want to pause in solidarity with the folk and the community in, I believe it's East Palestine in Ohio, who have been impacted by the train wreck and the fire with the train and releasing all of the chemicals that have been put in the air that people are breathing, and also possibly contaminating their water supply, those who use well water, et cetera. And so being from Flint, we know what it's like to be in a crisis and in a public health crisis. And so we want to just kind of pause just in honor and respect for those two communities, MSU and East Palestine, and in support of solidarity of those impacted, just for a moment. And our thoughts and prayers are with everyone impacted. So as we continue to think about long COVID, on last week we had a doctor and a nurse join us to kind of give us the breakdown of long COVID. Dr. Vereen kind of really went back into the lab, showing us how the cells migrate and what they do. And then Nurse T kind of gave us the everyday application of what she's seeing on the ground as a nurse dealing with long COVID. And so before we react to the video and what I mean by reaction, I'm going to have fire youth interns start kind of elevating and highlighting pieces and discussions from last week that kind of stuck out to them. And they might even want to highlight some things that we're going to share on this video that we're about to see. So for those who did not miss who did miss, I'm sorry, last week before last, that show, we do kind of have a summary video of giving you some education around long COVID, and then we'll go right into our discussion. So give me 1 second so that I can prepare to share the screen, and we will go right into it. Let me stop share, because what I didn't do was share sound, and that is important. Share sound. All right.
Take us to new adventures.
Thumbs up
and
if you can
long-term
hear
goals.
the video.
Your dedicated Fidelity advisor can
Right.
help you open those doors by helping you create a comprehensive wealth plan with the right balance of risk and reward.
Going right through the ad.
Doors were meant to be opened.
Here we go.
It has been more than 2.5 years since the first reported COVID cases in the United States. For some who've contracted COVID, the illness came and went. But according to the CDC, a range of symptoms still linger in nearly 1 in 5 American adults. For 2 women that we spoke with, one in Boston, the other in Florida, those symptoms are debilitating, painful, and life-altering. Our Phil Lipoff brings us their stories.
Cheetah's run. We're having so much fun with teaching Nisha on her birthday. And communicated.
It's a date I like to go back to when I'm in denial that maybe I am a hypochondriac. Hey, this is my peace offering to you all. Maybe I'm being a drama queen. But then I go back to a picture I have on my phone. And when I see that person in the video, I realize I have never been that person since that week. Well, my doctor was the one who I called actually first. She said, well, given your age and health, it should be no big deal. Just take some Tylenol and do some yoga. You're running, you're cycling, you're fit, and you're also 30.
All the patients in this room, they all have COVID.
Across the country, hospitals are gearing up for influxes of patients. Surge tents popping up around Boston, San Jose, and Salt Lake City.
Give me some water.
When COVID hit, Nisha was perfectly healthy. She was living her dream, graduating from Boston's MIT in 2014, had her own nonprofit, and was saving for a house with her partner. But after getting COVID in March of 2020, she was forced to put all of that on hold.
Everyone who met me said, just give it a couple more weeks. The more they saw me slowly going downhill, everyone kind of switched to, you're developing some type of chronic condition. We don't know what it is.
I'm terrified. I've been terrified for the past year. I've been especially terrified the last 6 months.
Month after month, her COVID symptoms persisted. And then Nisha started developing new conditions.
It feels like my brain is on fire, like it's being cooked on the daily. And last year, it was so intense that it was starting to cause me to have extremely violent involuntary body movements. The seizure disorder was getting to the point that I could count the number of hours I could be conscious and functional on one hand.
Struggling to find treatment, appointments were limited and doctors were skeptical. But then cases like hers began being reported across the United States and the world.
And I had one specialist who at first was like, no, like it's probably nothing, it'll improve in a couple of months. Have to come to me and go, my nurse, my right-hand woman, she had COVID a couple months ago, and everything I've seen with you, she's going through.
Tonight, the number of cases of coronavirus spiking here in the U.S.
Chinese officials are warning the virus could be even more contagious than first thought.
I know people want to hear it's only going to be a matter of weeks and then everything's going to be fine.
According to the CDC, 1 in 13 adults in the United States have had long-lasting COVID symptoms. The so-called long haulers have cleared the initial infection, but are left with symptoms that can last weeks, months, or even years. The symptoms of long COVID can affect different parts of the body, like the lungs, the heart, or the brain, according to the National Institutes of Health. The most common symptoms are fatigue, fever, respiratory problems, heart palpitations, digestive issues, and post-exertional malaise, meaning that symptoms get worse after physical or mental effort.
Some of the difficulties we have right now is, as physicians, we don't have good tests. We don't have good biomarkers. So it's been 2.5+ years. We still don't have something where we can definitively diagnose it.
Most people also report neurological problems, brain fog, headache, dizziness, pin and needle feelings, and sleep top the list. In many cases, the symptoms can be persistent and extremely debilitating. Even for physicians, long COVID is still not well understood.
In some cases, patients have been left bedbound. There's a large number of people who are applying for disability right now. It's probably the #1 diagnosis for people applying for Social Security and disability.
I had to sit down and take a break. Walking back to my car.
Life pre-COVID, I was a healthy, 30-year-old. I was finally obtaining, my dream of becoming a firefighter paramedic. I worked years to do that. I coached soccer and cross country, basketball. Going from being somebody who's incredibly active, somebody who's incredibly fit, to being somebody who's stuck in their bed the majority of the time, struggling to find treatment and doctors who understand what we're dealing with in the masses is very frustrating.
As a first responder, Karen became infected with COVID during the initial wave in 2020. Her COVID case was not as severe, but what came after was unexpected.
I suffer from over 85 different symptoms, but it's a collection and overlapping of all of these medical conditions that I've developed as a result of having COVID-19.
Just like Nisha, Karen's symptoms were so debilitating she was forced to stop working altogether.
It is like running a marathon for the simplest of tasks.
She can't coach or play soccer. A single mom, she tried applying for Social Security disability benefits, first in April of 2021, a process that took months, only to get denied not once, but twice.
There's not a lot of resources for us right now. What does it look like for single parents like myself, who are the only breadwinners in the family, who are now unable to work but are not qualifying for Social Security disability?
To this day, and even as a first responder, Karen has received no financial assistance from the Social Security Administration. She decided to create a group to connect with other long haulers and quickly learned there were thousands of people having similar experiences all across the United States. The COVID-19 long hauler advocacy group alone has gathered more than 13,000 patients, many of them struggling to find treatment and access to disability benefits.
So we're bringing agencies together to make sure Americans with long COVID who have a disability have access to the rights and resources that are due under the disability law.
Even when President Biden announced more than a year ago that long COVID would be considered a disability, and the CDC recently announcing that 4 in 5 people with long COVID have trouble performing everyday activities, things haven't changed for people like Karen. Experts say cases like hers are the norm.
People with long COVID are having a very difficult time accessing disability, even with the presidential memorandums.
Emily Taylor, who has done research on disability for years, says in applying for disability benefits, the process is long and the paperwork substantial.
Generally speaking, it can take up to 2 years. It's a long, extenuated process, especially with complex chronic illnesses like long COVID, where medical documentation is really difficult to achieve. Generally, it's about an 80% denial rate in the first round, and that was before the pandemic. So I expect that we're only going to see those numbers get worse as time goes on.
In a statement, the Social Security Administration tells ABC News that disability evaluations are based on the limitations that affect an individual's ability to work, not a diagnosis. They also say that to date, they have flagged 40,000 disability claims that include indication of a COVID infection, representing 1% of the disability applications they have received lately, and that they don't have more data on these cases to share. But experts like Emily are seeing a pattern.
And I think that's what's been happening with the people with long COVID is that they've been pushed out of a lot of the care systems and support networks that are meant to help people just like them. Lack of belief, lack of ability to document their illness, lack of medical care providers that are specializing in that illness or even understand what they're looking at. Long COVID is absolutely a mass disabling event. If we were looking at a potential impact of 8 million people becoming chronically disabled, that is a mass exodus from the workforce and a mass disabling event.
Just to assess your exercise tolerance.
Almost 3 years now into the pandemic, and without consensus regarding treatment, some hospitals have started opening up clinics to try and rehabilitate patients with long COVID.
Some patients may have more predominant neurologic symptoms. Some patients have more cardiovascular symptoms. So there's not a cookie cutter way to provide care for this patient. We don't have clarity of, if the patients will get better. We certainly have seen patients get better, but we also have seen other patients that are still struggling 2 years after their initial infection.
Is that you try to keep up with the beat.
Yeah.
The National Institutes of Health is spearheading a $1.2 billion initiative to research and find treatment for long COVID.
170, okay.
But the influx of patients is growing by the day, and the lack of treatment and resources is affecting American families. There are 3 bills sitting in Congress right now that would grant more funding for research and build more specialized clinics.
A conservative estimate is 9 million people in America with long COVID. They want to get back to work. They want to be themselves. This is not in their heads. This is not something that is just to get out of work or a disability scam. These patients just want to be themselves again.
It makes sense? You guys got it? Okay.
Without resources or treatment in sight, after years of fighting, Nisha had no choice but to push herself to go back to work.
Okay, forgive me.
Because just like so many others living with long COVID, all she wants is to be who she was before she got sick.
And I just want to go somewhere that my family can breathe for the first time 2+ years. Because right now, they've not been able to not stress about me. I just want them to be able to experience what was my career beforehand and them watching me twirl and teach and making science and engineering fun. And I want that moment back.
9 million people still suffering. Our thanks to Phil for bringing us that.
All right, so that was a nice kind of overview of what we mean by long COVID, and also a nice overview of kind of the impacts of it. I am going to also bring Jasmine on the phone. She's on the panel now. And so I wanted to, first of all, get reactions to it. We got a lot of information last week, and this kind of summarizes it. As young people who are kind of carrying the torch of public health, which also includes health messaging and community and health education, how does this information sit with you? Is it shocking? Is it not shocking? Is it making sense with things maybe you've experienced with your own family members or friends of the family or individuals that you may know? What is your initial reaction to this whole, because when I first heard of long COVID, I'm like, what you mean long COVID? Like, what does that mean? Like, is it, I'm short, but is there a short COVID? Does that mean I got short COVID? Like, what does it mean, right? And so I'm just trying to figure out what long COVID was. And now that we kind of have an understanding, what does that mean to you all? Go ahead, Everett.
I'll start us off. So to me, at least from what I've heard, like the whole COVID thing has always been kind of like an experimental, we don't really know what's going on. So I can't really say that it's a surprise to me that long COVID is a thing and that the effects are what they are. Just because like from the jump, like we didn't really know what we were getting into. You know, they told us we were going to be quarantining for 2 weeks, and then it turned into 2 months, then it turned into 2 years. So, you know, it never really was a surprise to me, but it is definitely eye-opening now to get all this information, to see what, you know, people are going through. because I don't really know anyone that is experiencing long COVID to like this extent. But just recently, like I go on TikTok and I'm seeing people talking about it. I go on Instagram, people are talking, like we're talking about it here in our group. So like it's seeming to me that long COVID is starting to become more prevalent and people are starting to recognize and talk about it more. Because in the past they would just say, "Oh yeah, you had COVID, but this is something different. Like you don't have COVID no more. You got, a respiratory issue or something." But now that they're actually, realizing that long COVID is a thing and what these people are experiencing is an after effect of COVID and not just, a random anomaly. I think that that is gonna, make the way and make progress, in the fight against it.
Thank you. Tomas, I see your hand.
It's very strange and ironic. I just had a mini not epiphany or like kind of awareness, if you will, that kind of birth after watching that video. Because when I researched long COVID myself, the definition and some of the effects that were on the CDC's website, and after watching the video, I've been blessed with God's will and grace not to have had those symptoms to that extent of long COVID, but I just kind of self-diagnosed myself as an ex-victim of long COVID. I had COVID in April of 2020 when it first happened. Me and my father did. And that's when it first began. And I remember that the main symptom I felt was a loss of taste and smell. And I was permanently without it for about 2.5, 3 weeks. And it slowly came back to normal. However, certain foods, certain items, it was like the most bizarre things, like fried foods, marijuana, as crazy as it sounds, different things smelled weird to me, like they had a similar smell and nothing was distinct anymore. It's very hard to explain, but after kind of watching this video, I was thinking, wow, I must have had it, because I still had that weird smell for about between 6 to 7 months after I had COVID. So I guess I kind of had midterm long COVID kind of, but like I said, I'm blessed not to have what that gentlewoman from Boston who was teaching engineering, or the other folks who had. I was blessed not to have that, but I just kind of self-assessed that I had it. So I feel like it's another case of, no pun intended, being unheard, really. Like people aren't taking it seriously, as they had noted in the video. Many people have been rejected disability and etc. So I feel like it's just a matter of really pushing this information more and encouraging policymakers and public health professionals to really take it seriously and take next steps to be proactive with addressing it. So,
absolutely. Thank you.
Yeah.
Go ahead.
What really stuck out to me was, and what continues to resonate with me, is the number of people that suffer from long COVID who, by society standards, are healthy, right? By even medical professional standards, like, are healthy. Even in the video, she talked about, like, she was active and exercised and was intentional about taking care of herself physically, and still has suffered from the impact of long COVID. And I think it's important for us to bring attention to this, because even when COVID was at its height, so many young people and those considered healthy did not take it seriously, because their understanding was it is a disease of the elderly, right? And that it impacts mostly those who have pre-existing conditions and or are elderly. And so it's important to bring attention to the fact that this is not discriminating. Disease does not discriminate. And although, yes, there are statistically, certain communities experience or take on the largest burden of the impact, it's not like, oh, this ghost will just sweep past your doorstep because you are considered by all intensive purposes healthy. Like, it's important that we recognize the signs and the symptoms in order to advocate for ourselves and in order to get the necessary help. And so that's definitely what stuck out for me, because so often COVID isn't taken seriously by those who don't consider themselves at risk, right? But in reality, what we're realizing is that everyone's at risk. There is no discrimination for this.
Thank you, Kayla. Anyone else? Go ahead, Cole.
Cruz, where are you gonna go? Oh, okay. like I had COVID in 2021. It was like January, December. In fact, like our whole family had COVID because it was just like unlucky because we were going to like an IQ test and one lady had it and we were just like, well, I guess we're all sick for the, forever. It felt like I had it for like a couple months, but I don't think I've had long COVID, but my mom has. My mom, Melissa Mays, had long COVID, and she's currently dealing with it right now. But I haven't felt much of brain fog, and I haven't felt much of any of the effects. But exactly what freaking Kayla said, it is indiscriminate. COVID don't care who you are. It does not. It does not care who you are at all. It will attack you regardless. It's not like, oh, an old person. No, it will attack everyone. And what kind of aches me to see is that just how infallible and just how stubborn the like the people who give disability benefits, I forgot their name, are to acknowledge this as an actual problem. Because 8 million people who suffer the same fate, I mean, they deserve reprimandments. They deserve something. That's terrible, you know?
Yeah, as someone who heard about long COVID for like at least a year, but it was so vague and ambiguous and not really discussed. When more information came to me, it was like I started to recognize like, wow, this is truly something that needs to be discussed, and it's a genuine problem. Because at first it just started with, like Tomas said, people not being able to taste, and I don't want to deal with that, obviously, but that seems relatively tame. But then as more information came, and it's like now we're revealing presently, this has been going on for a long time and it really wasn't discussed. And what's unfortunate is the way our country is currently set up, there are ways that things are gatekept because of that. Like because there's not a lot of information. Now there's not as many people fighting for people to receive, disability, and to stop people from actually getting the services that they deserve. And so one of my biggest issues with this has been is the overall tone of it. Like in some spaces, it's received as, yeah, this is a very big problem. And it has the potential to harm anyone. And then other spaces just like, don't worry about it. We don't need to wear masks anymore. Or even beyond that, it's not of your concern. Only the people who have suffered from it need to worry about it. And so, it's really been important to me now that we're hearing more about these things that we're actually starting to implement action. We need to start holding some of these, like people have been saying before, political figures, but more than just that, people like our health insurance accountable, because there are so many people that are being harmed by this. And we could suggest that before it was out of ignorance that we didn't understand that this was a real problem. But now that we're at this point, these people are still being continued to deny, these different services. And what really touched me is the single mother. Like, how do you continue without outside help if you can't work anymore? But you can't even receive something like a disability check because people don't believe what you're going through is real. Yeah, it's just disappointing to say the least.
Yeah. Thanks, Cruz. Anyone else? Amir?
Yeah, I think I had COVID in 2021. I think it was I think what no, it was okay. I forget which one, but like a lot of people get COVID. Obviously, it was shocking. Like to see, like I remember this one news reporter basically saying like everyone's gonna get it eventually, sooner or later, right? So you don't know. Like I mean, it's a case to case basis. But like I thought it was kind of crazy. Like some of my family members, they've had COVID 2 or 3 times over again. Like you don't really know when this long-term COVID thing is actually going to be like your second time getting it, your third time, or if you keep pushing it, your fourth time. You know what I'm saying? So I thought it was crazy to think about, like, as far as the health benefits and stuff like that, like as far as like the money you get from it, like disability. I think they should make it a little bit more easier and like less harsh for people to be able to get it. Because obviously people have the different situations that they're in financially and so on and so forth. So I think that was pretty crazy to see like how long it took for some people to actually get disability and be able to, be qualified for it.
Yeah. And I think you make a good point. There are people who get COVID over and over, and long COVID is more so defined as when a person no longer tests positive for COVID, but then they're having these issues even after they're no longer positive. But there are people who have gotten COVID and contracted the virus several times. Anyone else want to react? Go ahead, Chris.
I mean, going on top of that, Dr. Key, I think that's why a lot of us have concern for receiving more of this information, because there's a chance that we could still get COVID again, and it might impact your body differently now the next time that you get it. Yeah.
And what if you have long COVID and you have these symptoms and then you get COVID on top of that again? Like, what does that mean? Do you recover from COVID that's been compounded with long COVID? Does it make long COVID symptoms even more severe once you're no longer testing positive? Like, these are all the types of things that we have to ask, because as we said earlier, I think Cruz pointed out, we didn't know a lot of this. Everett pointed it out. A lot of this stuff we didn't know in the beginning about COVID, and we're still learning about the disease itself. And now this whole long COVID, the symptoms of it. Did any of the symptoms kind of shock you all? Want to talk? Go ahead, Briante.
Brain fog. I've met people that have had like that symptom. And even in my case, like I caught COVID, I caught the Omicron variant in December 2021, right before New Year's. And for me, I couldn't like think anymore. Like, people don't know everything I do. And at one point I was just trying to like, I do GIS, and at one point I couldn't just type something I was doing because it took me forever just to concentrate. And I thought it was something else going on with me. And it probably was, but it was like months, practice, and it was just getting worse and worse. Seeing that actually scared me. Definitely scared me. And we're in 2023, and I've just gotten to the point where I can, with a lot of practice, I can like build upon like little things I used to do. And I don't know if that was long COVID, but I did catch COVID, and I'm like, I don't know what's going on with me. Like, things just switch, things just change. That's the most scary to me, because like we were talking about, people don't even believe it. You go to a doctor, like, oh, you're healthy. I mean, I lost so much weight myself. I was like 50 pounds more than I am now. Even with the doctors that tell me, oh, you're healthy, just manage this, keep working out. I'm like, I work out like 5 times a day, and I do sports on my own. I do this and that, I do mindfulness, meditation. I can't focus. I can't concentrate. What's going on? So that one is the most terrifying.
Thanks for sharing that. And you lift a very important point, because and reason why I brought this up, many of these symptoms can be associated to other situations that people have in. So it's not like the list of symptoms itself makes it clear that it's from long COVID, right? People who have thyroid issues have brain fog. Like, it's so many different other health issues that have the exact same side effects and the exact same symptoms. So for some people, was it COVID that caused this, or was it something else, right? And so that's part of the ambiguity that kind of Cruz talked about. It's kind of hard to really pinpoint a lot of this stuff. But for example, the young lady that Kayla was highlighting from the video, she was active, she was healthy, she didn't have any of these symptoms, and all of a sudden she got COVID. Then she started having these symptoms. right? So it may be in certain situations kind of easier to directly tie the connection to COVID, but in other cases, it may not be. I think about Dr. Bailey when we were all at APHA, and you know, Dr. Bailey is she's an elder, but she was always active. She was one of those elders that would pass all the other elders and walking, wouldn't be tired, keep going, but she gets winded easier now. And she talked about that at APHA. You all witnessed it. And so these are things that people, not, she could say, well, is it just because I'm getting older? Or was it because of COVID? Well, we know pre-COVID in her old age, that wasn't an issue, right? And so there are a lot of things that we can talk about. How many of you all have ever suffered or are currently suffering from respiratory issues or digestive issues or fatigue or brain fog or sleepiness? Like, this is stuff that a lot of people are dealing with. Are any of you all dealing with that? And if you did, were you dealing with it pre and post-COVID or just post-COVID if you contracted it?
My case, pre and post, I always had like digestive issues, but I don't even know. There's like so little things I can eat. And that, like, for me, I always had like I said, I always have issues. So even now, I don't even know if it's long COVID. Like maybe my allergies just worsened or something else. Like, even talking about this now, I'm not even sure that it's long COVID, but when I caught the Omicron variant, I know that I didn't even lose my sense of taste or smell. I really just thought I had the flu, but just taking the test, find out later I have COVID. That's
Thanks. Anyone else?
So I know my fatigue and digestion issues started after I had COVID, and you just sit there and be like, am I a hypochondriac or something before, you know, starting to correlate those details? Because yeah, I mean, I used to not be so tired so frequently, but now afterwards I have been, as well as I feel like my stomach used to be like more iron, but now it seems like to wane with whatever I eat, and things like that. So it's just concerning. And for me to have like subtle and really like mild things, I know this must feel horrible to someone who like has way more severe or drastic symptoms. And still to be told that no, we don't believe you.
Tomas?
I guess now to kind of flip the script, my question to you, Dr. Kier, really anybody on the panel, what are some, and I know it's hard because a lot of this we're still, like Everett was saying, we're still discovering a lot of the unknown. We're living it right now, but what would be some advice or ways to combat these symptoms, like especially like the fatigue or anything for that matter that we might be facing? What are some suggestions that you might have for us, anybody? Because I know me, I don't know, because now I'm overthinking. I don't know, but I've gotten a lot sleepier. I've been liking to take more naps, and me personally, I don't know, maybe that's a toxic trait of mine, but I hate taking naps because I feel unproductive. Maybe I just do too much, but still, just to be safe, what are some things that we should do if you're feeling these symptoms?
Depends on what the symptoms are, but for your example with the fatigue piece is get more rest, drink more water. Anything that has oxygen in it helps to kind of fight the fatigue and give you more energy. Also your diet, what you're eating, less heavier foods or fried foods. Some would even suggest kind of limiting the amount of red meat that you eat, because it takes, your body works a lot harder to break it down, and it takes a lot. So here's a little joke on the side of it. I figured out scientifically why we get the itis after we eat. Y'all know what the itis is. After we eat, we get sleepy. Anybody know what's happening in the body when we get the itis and why we get immediately tired? Yes, Amir?
Doesn't like your brain like pull out the like the same type of like chemicals that does while you're like when you're about to go to sleep? Like, doesn't it like kind of, yeah, your brain Is that? I think
It's not your brain though. Nope, it's not your brain. Now
Okay.
your brain, my grandmother used to always say, when you're hungry, don't chew gum. What? She said, because when you chew the gum, your taste buds is absorbing the flavor. It's sending signals to your brain that you're eating, and then your brain then releases the acids in your stomach to break down food, but then there's nothing there to break it down. So then the acid is just wearing on the lining of your stomach, right? So when you think about ulcers and things like that, so that's something connected with the brain. But with the itis, even though you're not physically moving, your body is working, breaking down the food. Even though you're sitting still, your body is working, and it uses energy doing that. And so I say that's why we have to think about, when you're dealing with fatigue, what you're eating. Certain foods that take a lot more energy to break down than others. There are also different types of vitamins that you can take. There's even the little liquid oxygen that you can kind of put in your water. It's all kind of things that you can do to help with fatigue, but I don't think that there is a prescription, and I don't think it works the same on everybody. Everybody's level of fatigue is different. I know me, I went through a period where I just learned how to cope with the fatigue. And for some of us who have demanding schedules and those types of things, you just kind of like truck it out. That's not always the best approach, but you learn how to manage it. But again, to your question, Tomas, it depends on which of the issues or symptoms that you're dealing with, like with respiratory issues, right? Can you imagine already being asthmatic and then getting COVID and now having kind of compounded respiratory issues? Like, I don't know if there's a one size fits all answer, but I think you would have to tailor your lifestyle, meaning how you move, how you engage, what you eat, where you go, based upon what's needed to deal with that particular symptom. And unfortunately, most people don't just have one symptom. They have, they're compounded with others. And so it may also just create a lifestyle change. I know for a while I had brain fog. I was just like, and some people's brain fog is different. Some people is debilitating. They can't do anything. For me, it was like, why am I struggling to do this? I do this all the time. Like, let me go ahead and knock this out. And I had to really kind of coach myself. Anyone else want to kind of react to what the fatigue, what the symptoms were? Anyone?
Yeah.
Go ahead.
So for me, like, I felt like I didn't realize that like she had like a neurological thing that can cause seizures. That's crazy. I never heard that before until you showed me this video. Now that's very, very serious, obviously. So like, to me, I don't know, from it's like you said, it's a case to case basis. But like, I thought that was crazy. The heart palpitations I knew was a thing, because I feel like, because after I got COVID, I could feel like your heart, like some kind of like it would beat just irregularly. I don't know if that was me, but and then there's some other stuff, just like respiratory issues, stuff like that, like to catch your breath and things like that. So yeah, I thought the seizure thing was really wild to me. It was crazy. That was crazy.
Yeah. All right. Well, Cole?
Okay, so you know how I said earlier how I thought that I didn't have brain fog, but I'll be honest, I'm not entirely sure if I do or not, because I haven't had school in like what seems to be 6 months. So I'm just assuming it's because I haven't been in school, But I could be wrong. I have no idea. It's kind of worrisome. I mean, I know that I like in middle of a sentence I kind of forget, but I normally do that, I think that was just kind of like a Flint water thing, but I'm not entirely sure if I do or I do not have brain fog, and that's kind of worrisome. But I'll see how it goes when I actually do get in school this freaking May, because I'm slow.
All right, Cole. Well, anyone else have any final remarks or reactions they want to share? I think this was an awesome discussion, because I mean, we're everyday people, and we're trying to break down and understand what this health information is around long COVID. And that's part of public health, is taking the messages and translating them into everyday language where the average person can kind of get some understanding, and you don't have to have a degree or go to college to get it, right? We will continue to have some sessions on long COVID. We hope to have a couple of real life individuals come on and kind of share their long COVID. Some of them will probably be in severe long COVID impact, and others maybe a little bit more milder. But I think the more we hear from people that have it, remember, 1 in every 13 persons that has COVID has long COVID. And so 9 times out of 10, you know someone, you're kin to someone, you have sat next to someone, you've had conversations with someone who probably has long COVID. And here's the irony of it, and may not even know they have it. They may just think things are happening to them that they can't explain, or maybe they're just coming down with another type of illness, but it really could be symptoms of long COVID. And then we also need to think about, as the Academy, that we may want to think about what are some things and some messages we might want to give to legislators around providing the type of services, medical and health services, but also support. Like Cruz was saying, the young lady couldn't go to work, but yet she has a child. So what are some things that our policymakers need to take into consideration as we're coming out of the height of COVID, but now having to somewhat deal with the aftermath as we kind of are normalizing what it is to be a world and a global community with COVID. And so again, we thank everyone for joining us out there in Radio Land. We are the Flint Public Health Youth Academy, where public health is everything and everything is public health. We'll see you in 2 weeks. Have a good evening. Stay warm, stay safe.